Thank you all for being here today. My name is Michael McGovern. I'm with Progress Ohio, a statewide advocacy organization. We're excited to have this press conference today, 2 days after President Trump has nominated someone to the Supreme Court and 1 day before the first presidential debate here in Ohio. We thought it was important to bring together some state leaders and some national advocates to talk about both what we're seeing from the Supreme Court nominee and the threat she poses to healthcare in Ohio, and also set the stage, I think, for what it looks like in Ohio in the presidential race as we have the two candidates coming tomorrow to really sort of kick off the campaign season this fall. So I'm going to turn it over to Mayor Nan Whaley of Dayton to talk about Rob Portman's role in this and the threat, again, that this nominee poses to our healthcare. So Nan, go ahead.
Thank you, Michael. Good morning, everyone. I think our message today is very simple. As we embark in 36 days to election, tomorrow is the debate in Cleveland, that we are calling for no confirmation until inauguration. Senator Portman and the Senate should focus on the pandemic that has infected 150,000 Ohioans and have left more than 200,000 Americans dead. What is so difficult for me to understand is we have been begging for movement from the Senate for 4 months to make sure that we have federal stimulus packages that helps our small businesses, helps our local communities, and the Senate cannot move on that. Yet in 4 days, and now just 7 days later, 8 days later, they decide on who their nominee for the Supreme Court is, and are quickly moving that to a vote for confirmation. I think we know very clearly then what the priority is of Senator Portman and the United States Senate and President Trump. It is not the everyday people that have tough decisions to make about where their family should get health care, where their family should send their children to school or not, or whether they'll even have a job. Their interest is extreme politics being played on a lifetime appointment to the Supreme Court. A Supreme Court appointment moving this quick means that their nominee, if confirmed, would actually have the ability to overturn the Affordable Care Act, which will come before the Supreme Court in 6 weeks. So make no bones about it. Here they have the opportunity to actually support our communities and support people in need during this pandemic that is affecting everyone's lives. That is not the priority of Senator Rob Portman. It's not the priority of the United States Senate. What is the priority is an extreme judicial act before the election. Look, we're just asking them to do what the American public agrees with. Let the next president make the decision. The majority of Americans agree with this movement. They are instead ignoring that and paying attention to their extreme allies. And that's why this is so important and why we're calling on Senator Portman and the United States Senate to do the right thing for once and make sure that this confirmation holds until inauguration. The other issue I have with this overall is just the sheer hypocrisy of Senator Portman, where he sent a letter to the editor of the Cincinnati Enquirer of February of 2016, saying that was too soon to an election in February of 2016 to pick a judicial nominee. But now, 36 days, it's just fine. The hypocrisy of the Republicans in the United States Senate really knows no bounds, and we're asking for the American people to act to make sure that we protect important actions like the Affordable Care Act and ensure that a stimulus comes to our communities. Thank you, Michael.
Thank you, Mayor Whaley. Appreciate you being with us to talk about this today. I'd now like to turn it over to Chris Kang, who's the General Counsel with Demand Justice, a group based in Washington, D.C. Go ahead, Chris.
Thank you, Michael, and thanks so much for having me. I am Chris Kang. I'm Chief Counsel and co-founder of Demand Justice. I was former Deputy White House Counsel to President Obama and ran his judicial nominations for more than 4 years. And in 2018, started Demand Justice as an organization to help bring balance and legitimacy back to our courts. We have committed to spend $10 million to keep this Supreme Court seat open until inauguration. And it's really important. I think that Mayor Whaley's talked about the Senate's misplaced priorities. She's talked about the hypocrisy. And I think it's important to take a step back and realize just how rushed this process is. The Senate has not considered any judicial nomination for a lifetime judgeship this quickly in at least 20 years. And here they're doing it for a Supreme Court nominee. They're rushing through this hearing in barely 2 weeks after nomination, and it takes you a second to realize why. The reason is that Republicans, time and time again, are trying to use the courts to implement a far-right policy agenda that they could not achieve through Congress. We saw already the American people fought and won to maintain the Affordable Care Act, and yet here Republicans are, for a third time, trying to use our courts to strike down the Affordable Care Act, with the case being heard before the Supreme Court just a week after the election. And here, Donald Trump and Senate Republicans believe they have the nominee finally to do it. As I'm sure most of you know, the Supreme Court has upheld 2 challenges to the Affordable Care Act in 5-4 rulings, and one of those 5 justices who upheld the Affordable Care Act was Justice Ginsburg. And now here we have Amy Coney Barrett, whose record is actually remarkable. It's not often that we have nominees who are so clear on legal issues who are coming before the Senate in fights like this, but Amy Coney Barrett's record is. She has made clear that she disagrees with both of those major rulings that have upheld the Affordable Care Act. She has declared herself just on Saturday as a protege of former Justice Antonin Scalia, who would have thrown out the entire Affordable Care Act. And so we know this is the real agenda that Republicans are trying to achieve. They're trying to throw Americans and Ohioans off the Affordable Care Act during a pandemic. They're trying to take away protections from people with pre-existing conditions. And they're trying to do this in a hypocritical way that not only upends the statements that they made in 2016, calling for a process in a less partisan environment. I mean, we're not even in election year anymore. Votes are being cast right now. And they're doing it to rush through, not just so that they can have a nominee in place for any election-related disputes, as President Trump has said, but really November 10 is the day they have marked on their calendar. They want this justice in place to overturn the Affordable Care Act. Thank you.
Thank you, Chris. Appreciate you being with us here today. Now I'd like to turn it over to Representative Janine Boyd, who is the ranking member on the Ohio House Health Committee, to share her perspective. Go ahead, Representative.
Good morning. Thank you. Thanks to everyone who's joined us this morning. My name is Janine Boyd. I am the state representative for House District 9. That includes all of Cleveland Heights, Shaker Heights, University Heights, and I share parts of wards 2 and 4 of Cleveland. As was mentioned, I have the privilege of serving as ranking minority member on Health Committee in the House. I'm also a co-chair and co-founder of the Black Maternal Health Caucus, and also a trustee on Ohio's Children's Trust Fund Board. And I began my career as a speech and language pathologist, pediatric speech and language pathologist, and I saw then disparity between the way services were delivered to children on Medicaid versus private insurance. That led me to become a child advocate and then later a legislator to protect services and programs and resources like the Affordable Care Act. What is most shameful about this situation we're in now is that in 2016, Donald Trump campaigned in Cleveland, across the state, through Toledo and Cincinnati, saying that he would expand healthcare and reduce costs. That was an enormous lie, and one of many, as we have come to find out. And since 2016, Ohio is one of the few states where the number of uninsured is rising. And we see the greatest impact of those rising numbers on children. Before the pandemic in 2019, about 150,000 children in Ohio were already left without insurance. This is another shameful rise after the Obama presidency. Then came the pandemic, when more than 1.7 million Ohioans filed for unemployment, losing their insurance as well, many of them losing their insurance. The hits to families just keep on coming under this president. We've had the ACA for a decade. Many of us won't even remember what it was like before it. 800,000 Ohioans could lose their coverage if we lose the ACA. 80,000 of them are the young folks who get to stay on their parents' coverage under the ACA. And then let's really talk about going backwards under this presidency. Insurers could once again deny coverage to the 5 million plus Ohioans with a pre-existing condition, like high blood pressure, asthma, and including the 150,000 Ohioans who tested positive for COVID-19. That would be considered a pre-existing condition. Costs for all of us will rise. On co-pays and premiums, 5 million Ohioans would once again have to pay for preventative services. Preventative services, that's flu shots, that's mammograms, and other kinds of cancer screenings. I need everyone listening and watching and reporting to understand that right now, the ACA requires insurers to offer at no cost to consumers these kinds of preventative services. You will have to pay for them. We will all have to pay for them. And that's just the impact to us as patients. The Ohio Hospital Association, which I hear from frequently in my role on health committee, has said that as many as 25% of the state's hospitals would have to close. That's predominantly in rural communities. And that is because of the $2 billion plus uncompensated care they would then have to shoulder without the ACA. The Cleveland Clinic here in Cleveland, one of the sponsors of Tuesday's debates, has itself said repealing the ACA would prevent Ohioans from going to get the care that they need and deserve, and inflict very deep financial trouble at a time like this. And what about the people who rely on Medicaid for addiction treatment, such as opioids? You know, my colleagues have often identified the opioid crisis as something we need to address as elected policymakers. What happens to them? Treatment that keeps them on the path to good health, restored health, and the path to contributing positively to our communities rather than negatively impacting our communities. And I'll just leave you with this. Racism is indeed a public health crisis. Make no mistake. Black and brown people will once again be most adversely affected by an outcome like the one this president is aiming to achieve in the courts. Thank you.
Thank you, Representative Boyd, for being here and sharing your perspective from the Ohio House. Now I'd like to turn it over to Columbus City Attorney Zach Klein, who also has quite a bit of experience fighting the Trump administration and their attempts to undermine healthcare for Ohioans. Go ahead.
Thanks, Michael. I appreciate it. This is by my count, the third way Donald Trump, Rob Portman, and Republicans are trying to eliminate the Affordable Care Act, and along with it, protections against pre-existing conditions and Medicaid expansion. First, they tried the legislative route with the repeal and replace. That failed after Republicans in DC took over 70 votes to dump the ACA. And by the way, they have not once offered an alternative. Then President Trump tried the executive order route by intentionally sabotaging the ACA. I'm leading a national lawsuit in federal court on behalf of cities across the country against the undermining of the Affordable Care Act. State's attorney general are doing the same thing. Trump's losing there too. Now they're trying to ram through a Supreme Court pick to overturn the ACA a few weeks before an election. Judge Barrett is on record claiming her disapproval of the ACA and has indicated that it must be eliminated and overturned. And even Trump said that by confirming Judge Barrett, Republicans can finally overturn the ACA and get it off the books. All in the middle of a pandemic with no alternative. On the eve of an election, let the voters decide whether Joe Biden or Donald Trump should fill this seat. We know Judge Barrett's record supporting overturning the ACA and all its important protections. Republicans are using a constitutional loophole to get a new Supreme Court justice to do their bidding because they have failed so many times to get it done themselves. Americans want and deserve good quality health care that's affordable. and pushing through a Supreme Court justice who is openly against these values right before an election isn't fair to the American voters, and it just isn't right. We can't let the chaos of the Trump presidency bleed into the health insurance market by confirming a justice who wants to gut the ACA in the middle of a pandemic. Thank you.
Great. Now I'd like to turn it over to Dr. Catherine Romanos. She's with the Physicians Action Network, which is a statewide network of doctors throughout Ohio who are advocating for better healthcare policy. So Dr. Romanos, go ahead.
Hi, thanks for including me on this panel. It's a real pleasure to be here. Again, I'm Catherine Romanos, and I'm a family doctor, and I'm representing the Physicians Action Network. We're a statewide group of interdisciplinary physicians who are fighting for the health and lives of our patients. And I'm particularly glad to be here because I'd like to offer the perspective of someone who is using the ACA and taking care of people who are using the ACA every day. And myself and my colleagues are genuinely worried about the care that our patients won't be able to get if the Supreme Court nomination goes through, and if and when the ACA has even more rollbacks or is completely overturned. As the other panelists have said, we're in a moment when we need more healthcare and better healthcare for our patients. Mayor Whaley said so eloquently that we're in the middle of a pandemic, and in the middle of a global pandemic is not the time that we need to decrease access for patients. And moreover, we're learning every day that not only is this pandemic going to go on for a long time, but we might be taking care of the results and the long-term sequela of COVID for a long time. And we're going to need to be able to assure that people have access to that care. Rep. Boyd was so smart in mentioning that people need flu shots. This season and next season in particular, we need to make sure that everybody who can be vaccinated for the flu and can be vaccinated for pneumonia is. And without the protections in the ACA, we can't be sure that we're going to be able to reach the numbers of vaccines that we need to be able to control two epidemics at the same time. And finally, I want to echo what Rep. Boyd said about racism in healthcare. We know that if we take the ACA protections away from patients, it will be the most vulnerable poor Black and brown patients who suffer over and over and over again. And so I just want to be here to say that on behalf of the physicians taking care of patients who are using the ACA, I'm really worried about what will happen if those protections are gone. And then I guess I'll add one more thing. Some of the other panelists have mentioned that what happens when those protections are gone all of a sudden in terms of even chronic health problems like opiate abuse or hypertension or asthma. And what it means is if you take someone's prescription coverage away abruptly, their hypertension, for example, could go from being controlled to uncontrolled. And that means a stroke. If you take a medication away from someone with opiate abuse disorder away abruptly, that means they go from having their addiction treated to untreated. And what happens to that patient? And so I think we really need to think about the people that will be affected, the hundreds of thousands of people in Ohio that will be affected if we allow this Supreme Court nomination to go forward. Thanks.
Great. Thank you so much for being with us, Dr. Romanos. So I'd like to close today by turning it over to Jessica Hare, who is a person who has personal experience with the Affordable Care Act and receiving care through it for her family, and I think really offers a different perspective and really puts a real human face to what we're talking about here today. So Jessica, if you want to go ahead, I'd love to hear from you.
Sure. Hi, everyone. As Michael said, I'm Jessica Hare. I'm a mom who lives in North Royalton, Ohio. I grew up in Ohio in a very conservative Republican family, blue collar, where you worked hard for what you wanted in life. I met my husband in college, and we're both professionals who have had pretty successful careers. Never in a million years did we think that one day we'd have to rely on the system to keep our son alive, but life is funny like that. When I was 34, we decided it was now or never if we wanted kids. So we started trying and I got pregnant right away. My pregnancy was uneventful. Screenings came back negative. At our last ultrasound, the radiologist even said what a mover our son was, and there was never anything to indicate that there would be any issues. Then my water broke a month early. We rushed to the hospital just because we felt a little uncertain. We got there in the middle of the night, and even though only 2 people are supposed to be with you in the labor and delivery room, the hospital let my entire family back, which was great. So my husband was able to usher them out for coffee, and of course that's when active labor started. He ran back, and they were waiting in the hall, and then my son was born, and he was gray and lifeless, and sorry, and we were so confused. Sorry. Thankfully, there was a NICU team in the delivery room since he was early. They immediately started working on him in the corner, and code pink went out over the system. My family sitting outside my room heard this and saw more doctors running in. All the while, I kept bleeding, and my husband didn't know whether to be with me or the baby. In a matter of minutes, they were ready to whisk the baby away, and they brought him to me in an isolette. And I picked up his lifeless hand, and then they were gone. They brought him to main campus of Cleveland Clinic. They thought he'd had a stroke. My husband went with them, and I eventually joined them, and there we stayed for a very long time. In the NICU, we stayed there, and my son named Declan went under so much testing for a diagnosis that he needed blood transfusions. We stayed when he was becoming too weak to sustain himself on CPAP. We stayed through offers of comfort care where we said no and that our son was very much in there if only we could give him a chance. So we decided to do a tracheostomy at 8 weeks old, which we were uncertain whether that would help or not, and we watched him thrive after that point. But still no diagnosis. So I remember when the geneticist came to us and recommended that we sequence Declan's DNA along with mine and my husband's. And the first words out of my mouth were, "Doesn't matter if he has a diagnosis, I don't want him to have a pre-existing condition." And she kind of looked at me shocked, which any rational person would do, and say, his whole life is a pre-existing condition. But thankfully for us, Declan was born in 2012 and pre-existing conditions were covered. Otherwise, we hit our limit in the NICU. After a few months, we transferred to a rehab facility where we expected to be for 6 to 8 weeks. But time continued to march on. We spent all of Declan's first holidays living in an institution. You see a kid like mine with a trach, a vent, and a G-tube needs 24/7 care, awake care. And thankfully, again, for us, there's a program called Medicaid Waiver, specifically for families who work, for parents who want to continue working and have their kids taken care of at home. And if kids like Declan can qualify, they can get skilled care living in the community at home with their families. In the end, it's a long story how we got there, but in the end, we stayed at the clinic for the first 19 and a half months of our son's life. And every day has been a fight since, and the Cleveland Clinic has been with us every step of the way. The one other thing, Declan finally did get a diagnosis when he was 7 months old, and we were told to expect to have him until he was a year old, even though he was doing great. And the doctor said it didn't matter. Well, this year Declan turned 8. He's in 3rd grade and he's thriving. He's a dinosaur-loving, social studies-hating kid who's cognitively on track with his peers, but he still has a trach, a vent, and a G-tube. He requires a wheelchair to get around and a speaking device to communicate, although he prefers using ASL to spell. But each of these things that are giving him life, giving him a voice, is a fight, even with insurance and Medicaid and BCMH coverage. Simple things my son needs to live a full life, like a power chair, costs $68,000 so he can sit, or a speaking device that costs $10,000. He has PT, OT, and speech therapies each week, which we have continuously had to petition for to keep his strength progressing. He still requires 24/7 awake care, which is nearly impossible. So my husband and I cover any shifts we don't have nursing. It is only because of the Affordable Care Act that Declan is alive and thriving. It is only because of the Affordable Care Act that my husband and I aren't bankrupt and we're still able to provide for our son.
Without it, we would have blown through any annual or lifetime limit long ago. And of course, Declan will always live with pre-existing conditions. And without the Affordable Care Act, my family has no options. I don't know what will happen to us, or theoretical for me, this is life and death. The president, Senator Portman, and Amy Coney Barrett say they are pro-life. In 36 hours, the president is going to be in the clinic where my son fought for his life for so long and where we fight every day for the debate. And we're there thanks to the ACA, and with which Amy Coney Barrett and Portman and Trump want to end. The president will go there and lie about what his real plans are for families like mine. And instead of going along like usual, I challenge Portman, I challenge the Cleveland Clinic, and anyone else listening to say no. I'm asking for help to keep my son alive.
Wow. Jessica, thank you for being with us and sharing your story. I think that really puts a fine point on just how real this is, and how this is a much bigger conversation than just politics and policies.